Good afternoon, Dr. Costa.
Good afternoon.
Just to, I guess, clarify a little bit about the presentation that you will give earlier or later today. You are the National Program Director for Air, Climate, and Energy Research Program in the EPA.
That's correct.
All right, so you know we're going to talk policy and regulation here with regard to ultrafine particles.
Okay.
Okay.
I'll speak to the science policy rather than the specific regulatory policy.
Works for
Just
me.
only because within the U.S. those are distinct entities, and I can't fully represent the policy end of things except in the context of science.
That's fine. So the status of current affairs with regard to regulating or managing UFP emissions.
In the U.S.?
Yes.
Well, the U.S. EPA just promulgated a new PM standard December 14th of 2012, which revised the PM 2.5 standard annual level from 15 to 12 micrograms per cubic meter, and left in place the other standards as they were. In the development of that standard, there is a document that is prepared over the course of several years with incredible deliberative review that's called the Integrated Science Assessment. And within that assessment, not to sound too bureaucratic, they essentially evaluate all the pertinent literature. And one section of that is on ultrafine particles. And after going through that review, looking at the relevant epidemiology and the toxicology and exposure science, it was deemed that the data were suggestive, but considered inadequate in the context of the regulatory decision making. These standards in the U.S. have billions of dollars of impact, and so the review process, scientifically, with representation of the public as well, public comment and corporate private sector comment, is very involved. So when they make a decision, it's based on really hard science. And they actually use a process, it's called the development of causality, where they go through various criteria for evaluating causality. It's not until the data is pretty compelling, close to causality or likely causal, will they make a decision.
So prospects are bleak, or
prospects are the data, that more science is needed. The epidemiology that does exist is largely from Europe, using measurement methods which are not like those that are used here in the U.S. or in the U.S. south of the border. So the measurement aspect is not there, and it's usually related to a source. It's near road, you see some health effects, or it's near a specific combustion source, you may see some health effect, but it's just not enough there to sell the day to make it through this process.
So what is the role of ultrafine particles in a multi-pollutant management approach?
Well, as it turns out, because ultrafines are largely associated with combustion, and virtually all pollution air pollution is associated with combustion, those things that you do to minimize the effluents, the byproducts of combustion, just as our approach to some of the climate issues are considered a co-benefit. As you reduce PM, you're reducing carbon dioxide, you're reducing ultrafines. And so there are those benefits that are coming along. That said, there are certain aspects of combustion where if you combust things at a very hot temperature to reduce a lot of the gases, to reduce the particles, you may in fact increase CO2 under certain circumstances, and you may increase ultrafine particles under some certain circumstances. But what they're trying to do is with the science of combustion, is move it in the direction of controlled technologies to hopefully get a co-benefit, alleviate that problem within the broader context.
But like everything else, there's no easy solution. There's
No
always a
easy
trade-off.
solution. And some of it is the unfortunate sort of victim of definitions. You know, we talk about ultrafine particles as particles, but in reality, and as was discussed in great length today and very nicely, as you combust materials, you produce ultrafine particles. They agglomerate mostly with particles that are a little bit bigger than themselves and move into the domain of the fine particles. So fine particles are really the first cousins of ultrafine particles, but sort of grouped. Okay? So what you have with ultrafine particles near a source is something that probably closely reflects that source. But when you get to fine particles, it's really a pretty complex mix of a lot of sources, and chemistry, and water, and sea salt, and everything else that's there. So to say that ultrafine particles are just part of particles, it really isn't. It actually is more like, if you're a nickel factory, it's more like a nickel problem, sort of an air toxic kind of interest. So while the PM 2.5 standard is an ambient air quality standard that's designed to be across the entire ambient environment in the U.S., the ultrafines are more likely to be source-specific and around specific environments, whether it's near road or diesel or a factory or something like that. So they're really kind of different. And just because they're called particles kind of gets them lumped together. That if we regulate one, we should regulate the other. But they really aren't.
All right. So I would think that the theme for today would be that ultrafine particles do exist.
Mm-hmm.
There are some risks inherent in them, and we don't know enough about them.
That's pretty much the story. And, you know, it's interesting. You can take, you know, in occupational environment, welders, if you're welding zinc, you can produce zinc oxide. Zinc oxide causes a occupational disease, occupational phenomenon called welder's lung or acute respiratory response. If you do that with magnesium, you don't get any of that. Exactly the same size, ultrafine nanoparticles, same exposure circumstance, same people, different metal. So there's a compositional element. Just because it's ultrafine doesn't mean it's suddenly special.
Well, all right. We obviously have a lot of thinking to do and a lot of work to do. Thank you very much.
Okay? Thank you.